So for my 3-minute video, I wanted to highlight a health disparity in a specific group. So I decided to talk about maternal mortality among Black women in the US. So CDC data shows that Black women are 2 to 3 times more likely to die from pregnancy-related complications than white women, with most of the maternal deaths being preventable. This heightened risk spans all income and education levels, and Black birthing people are also more likely to experience life-threatening conditions like preeclampsia, postpartum hemorrhage, and blood clots, as well as increased incidence of other pregnancy-related complications like preterm birth and low birth weight. So why is this a disparity that exists? Research has documented that social and economic factors, racism, and chronic stress contribute to poor maternal and infant health outcomes, including higher rates of perinatal depression and preterm births among Black women and higher rates of mortality among Black infants. So one contributing factor is lack of insurance. As of 2019, 14% of Black women were uninsured and 25% were using Medicaid. And certain states have poor Medicaid expansion, which prevents access to important care. Another contributing factor is chronic stress. It's been shown that many Black women experience chronic stress due to systemic racism. This chronic stress causes the body to produce high levels of cortisol, which can lead to things like gestational diabetes or preeclampsia, and it also plays a role in preterm birth. And then the final contributing factor is racial bias. This bias is often implicit and can result in negligent care that is often based in preconceived racist ideas about the biological makeup of Black women's bodies. In healthcare, racial bias has been found to cause medical negligence in the form of underdiagnosing illnesses, disregarding complaints of pain, and not fully adjusting the symptomology of an illness. And many Black women have reported just instances of their doctors not taking them seriously, and so then they aren't treated properly and their pain isn't taken seriously. So what can be done to try and reduce this disparity? So first, there's some policy solutions, things like expanding postpartum Medicaid benefits to a full year rather than the 60 days required under federal law, since so many Black women use Medicaid. And then healthcare system and education reform, just making sure equity is front and center of education of new healthcare workers and calling out biased hospital policies, as well as addressing biased care practices within clinical care. It could also be really important to expand access to midwives and doulas to assist Black mothers, as they can play a critical role in reducing racial disparities in maternal health. And then finally, things like expanding and diversifying the maternal and child health workforce. This could help because it can improve access to culturally competent care for minority women, foster better patient-provider relationships, and increase understanding of the unique health needs and social determinants affecting Black women, and which would eventually lead to better preventative care and early intervention strategies. And then these are my references. Thank you.